We're not the first to say this, and we're not saying it for the first time. Our appeal was actually released several months ago. But until this point, we didn't really have an evidence base around which to have this conversation, which is why, for the last few weeks, representatives of the International Federation of Red Cross and Red Crescent Societies, together with the staff and volunteers of the Sri Lanka Red Cross, have been interviewing people across Sri Lanka, all 9 provinces, across 11 districts, to try to understand how people are experiencing the economic crisis, what's it meaning for their lives, and what may be the sort of interventions that are going to help. You know, we're going to hear some more details about the findings in a few moments, but you know, the headlines, it is affecting people across the country, all of the country. It's not a geographical crisis. Like most crises we deal with, this actually is very, very widespread. And pretty much everywhere we are seeing that income is down, and therefore consumption of food is down. Access to medical care and medicines is restricted. Malnutrition is on the rise. Indebtedness is on the rise. More and more children are either going to school less frequently or dropping out altogether. And more frequently, women and girls are concerned or facing the risk of sexual and gender-based violence. Now, there is no one definition that we use for a complex humanitarian emergency in our sector, but we know it when we see it. When we see large numbers of people who are clearly going through a crisis and unable to cope with that crisis or recover from it without some form of assistance. When we see that critical institutions in a country which are essential to people's welfare, a well-functioning health system and education system, are not functioning as they were before or are going through a crisis of their own. When large numbers of people are suffering, and particularly where people who are already vulnerable are suffering most of all, when we see these things, we are recognizing what is a complex humanitarian crisis. When we look at the report, when we look at the findings of this survey, what we see are conditions that are consistent with what we normally see in other humanitarian crises around the world, which means we feel our services must be activated. Now we know here, as we know elsewhere, that humanitarian action is not the solution. The more durable solutions have got to be around investment, debt restructuring, a well-functioning social welfare system, the restoration of institutions that are struggling. We know that. But what we believe, looking at these findings, is that the sort of things that humanitarian organizations do, the sort of things that the Red Cross normally do, the provision of cash, the provision of nutritional support, efforts to ensure that school feeding programs continue, efforts to ensure that people get access to healthcare, efforts to ensure that people have an opportunity for economic regeneration of their own household economy, awareness and prevention of sexual and gender-based violence. These are the sort of things that humanitarian organizations do, and right now we would say they are appropriate in this context. You know, we know, as I said, it is not the long-term solution. It is a way of trying to ensure, during the economic crisis, that people who are suffering at the moment and becoming increasingly vulnerable and indebted do not slip into a destitution that is impossible to recover from. With the right type of assistance over a limited period of time, hopefully no more than a year or 2 years, it will be possible to avoid the worst consequences of the economic crisis. Now, there is a lot going on in the world at the moment, even just in Asia Pacific where I work. But if you look at the world more broadly, there are many, many crises. Just 3 big ones: Ukraine, the hunger in the Horn of Africa, and the flooding in Pakistan. It is extremely difficult to advocate for humanitarian support for contexts such as this, when you look at it in comparison with the other crises in the world. However, what we hope is that by producing this report, by showing the evidence it will be easier for us to advocate for support which we hope will both save lives in the short term, but in the long term, protect people's health, well-being, and prevent them from slipping into destitution, and giving them a chance in the future to recover.